In this video, we will discuss the third principle, create independent checks. This is based on the idea that we are human and can make mistakes. Independent checks ensure we have reminders in place essential to patient safety. To be successful in carrying out independent checks, all team members must feel comfortable speaking up. They must question colleagues when a step is missed. If not, the patient could be exposed to preventable harm. Henry Ford Wyandotte Hospital, Director of Regional Oncology Frank Torti, and pharmacist Mohammed Shazra will show how this principle is helped through chemo checks.
The drugs that we're giving are very toxic. Although they're beneficial, they are also very toxic, and an error in this situation is not reversible and can also lead to a death. The independent check creates a scenario where the individual employee has an opportunity on their own to verify that the work that they've received from somebody else is what they expect to see. So by checking their work first against what was given to them, we can verify that the correct items are being delivered to the correct patient. If you're doing a double check, you're obviously just checking against somebody else's work. You might have a tendency to just accept the work because your eyes will see what you're expecting to see versus what you actually have in front of you. So when the patient arrives, we release the treatment plan and the prescription order to the pharmacy. The pharmacy will prepare the drug based on the treatment plan. They provide a number of checks within their system of scan and visual verification.
It's important because definitely the ultimate goal is we need the right drug, the right amount of drug to the right patient. Once the technician gives me the bag, I read the label, make sure I know what I need to look for. So once I read it and no one needs to be in there, then we have a scanning where we scan it to the computer. I'll scan the bag. Each bag has an individual code, if you will, for that particular patient and that particular medication. And then I'll scan the medication. And I have to make sure that those scans are what's supposed to be in that bag for that particular patient.
When the drug is prepared, they will bring it to the oncology suite. The oncology nurse will now, prior to getting the bag and getting the patient ready to receive the drug, they will go into the Epic system, look at the treatment plan, verify that they have a drug for patient X, drug Y, and whatever setup is required. Once they have the drug in their hand, they'll now do an independent check to make sure what the drug that they've received matches what they're expecting to see. Then they'll prepare it for the patient. It's a very open environment here. I think it's something we've always encouraged in all of our oncology settings, and it's just part of the industry because there is just so much at risk. To not talk about a near miss is also going to create a bigger problem. So they're all very forthcoming. There's never any issue about bringing up something. Every opportunity that's brought to the table is something for us to figure out how we can do it better.